So young people, come out, get your vaccine, get in the raffle, and try to win a full scholarship. But get the vaccine anyway because it's just smart. And we're still watching COVID. It would be irresponsible and reckless not to be wary and vigilant about COVID. There are new variants. The Delta variant they're watching now spreads much more quickly than the original virus code. It's in the United States, didn't start in the United States, but one thing COVID showed us again is how small the world is. It's not like the old days. Well, that's happening in Europe. It has nothing to do with us. That's in China. It has nothing to do with us. No. What happens in China tomorrow is our problem today and the week after. They get on a plane. It's here. Well, COVID was in China. Yeah, COVID was in China for 24 hours. And then COVID was in Europe. And 24 hours later, COVID was in New York. That's what happened here. Well, COVID's in China. By the time they were saying COVID, it was in China. It was already in Europe. And then it was in France, Spain, Italy. They got on a plane. They landed at JFK. Why did New York have that high vaccination, the high infection rate all of a sudden? Because it had been coming from Europe for weeks and weeks and weeks, and nobody knew. What a mistake. So, stay wary, stay vigilant. The Delta variant, the virus mutates all the time. There are hundreds of mutations of this virus. Right now, they say the vaccinations manage all of the mutations. But God forbid there's a mutation that the vaccination doesn't work, right? Then we're right back to zero. And, not to be the bearer of bad news, but to be the bearer of common sense, there will be another virus. There will be a next one. We don't have the luxury of saying, well, COVID, we managed. That's it. Never happen again. It will happen again. And we have to be prepared. But the emergency is over. The state of emergency that I had declared in consultation with Commissioner Zucker, a health emergency, it expires tomorrow. It will not be renewed. It will punctuate the expiration of the emergency that we have been in because New Yorkers rallied and essential workers rallied. Let's give everyone a round of applause. The emergency is over. The CDC guidance still stays in effect. The CDC mask requirement for unvaccinated individuals, public transportation, homeless settings, certain institutions, and local governments may continue, and I would urge them to continue to enforce those mask requirements where they are in effect. But in this new post-COVID period, we go down two tracks simultaneously. One, reimagine, rebuild, and renew New York. Everyone talks about just rebuilding. I don't want to just rebuild New York. I don't want to say that we went through this whole last year and rebuilding suggests you're going to go back to where you were the day before COVID started and reestablish where you were the day before COVID started. I don't want to go back to last year. Life is not about going back. Life is about going forward. And we've learned a lot since last year. We've learned many lessons during COVID. So we're not going to just rebuild. We're going to reimagine New York. What did we learn? And now we're going to reconstruct. And how do we reconstruct it better than ever before? How do we use this moment of rebuilding and reconstruction to reimagine New York? We've gotten billions of dollars from the federal government. I don't want to just replace what was. What should have been, right? We have a storm, Hurricane Sandy, your house gets knocked down. You don't rebuild the house the same way it was. You put in a better kitchen. You put in a better bathroom. You put in a better heating system. You put in solar panels. You use the opportunity to reimagine and to renew. And that's what we're doing in New York. New airports, new transportation systems, new Long Island Railroad, new broadband access. So every family now has access. New healthcare procedures. Because look how much we learned about our healthcare system and how we were not ready for the emergency. Learn those lessons and incorporate them. Governmental, societally, also personally. New Yorkers, get a vaccine and get on with life. Get out of the house. Go experience New York. Go to a movie. Go to Radio City Music Hall. See a concert. Go root for the Islanders, especially tonight. They have to win tonight. Go tonight. Root for the Islanders. Go to a restaurant. Go shopping. What people do is a major factor in bringing the economy back quickly. I'm going to go shopping. I need new ties. I think I've been wearing this tie about 10 times over the past year. Go out. Live life. Life was not about what we were doing the past year. We were surviving the past year. We were surviving. Life is about thriving. Go reconnect. Enjoy life. That's the first thing. 2, learn the lessons from COVID. Learn the lessons from COVID. COVID knocked us on our rear end. Things happen. Life will knock you on your rear end. You'll make a mistake. Something will happen outside of your control. Somebody gets sick. You lose your job. You get divorced. Something will happen in life that just knocks you on your rear. The question becomes, what do you do when you get knocked flat on your back? What do you do? And that defines you in life. That moment defines you in life. You're watching a boxing match and the guy gets knocked down and the crowd all leans forward. What is he going to do? What is she going to do? Are they going to get up? Are they going to get up, or they're just going to lay there? And are they going to get up and they're going to be smarter for it and say, I'm not going to let that happen again. I felt it, it hurt, but I'm going to learn the lesson. We're going to learn the lessons from COVID. Part of it is our healthcare system, being able to handle an emergency, doing it safely, being prepared, being equipped. Remember what we went through when COVID started? We had to set up the largest field hospital in the country in Javits, 2,500 emergency beds. Our hospital system was going to be overwhelmed. Every expert came in and said, you're going to need at least 150,000 hospital beds, Governor. 150,000 hospital beds. You know how many hospital beds we have in this state? 50,000. Well, you're going to need 150,000 in 2 to 3 weeks. That's what I was told. Thank God we had the essential heroes that we have. Thank God the state worked together. So the upstate hospitals supported the downstate hospitals, Long Island hospitals supported. But we were on the brink of catastrophe and chaos. Don't underestimate the lesson of COVID. We were right on the cusp of total chaos. That hospital system becomes overwhelmed, like Italy, by the way, at the time. And now you have people dying in hallways. You have ambulances don't come because they have nowhere to bring you. That, my friends, was chaos. And I feel that deep inside me because we were that close. Learn those lessons now and correct those lessons now. We couldn't get vaccines. We couldn't get the Q-tip swabs to administer the vaccine. You couldn't get masks. We ran out of masks. We had to send private planes to China to buy masks from China. Masks that we were paying 70 cents per mask, we were paying $7 per mask and having to get them from China. We didn't have the right medicines. We ran out of supplies. We didn't have PPE. Nurses were going out there to work with garbage bags over them. Garbage bags as PPE. How could that happen? United States of America, New York. Federal government was nowhere to be found. They were, you're on your own, New York. Call us when it's over. What did we have? We had essential workers who did the superhuman. Essential workers is a new term. We made up the term essential workers. There was no such thing as essential workers. If I could do it over again, I'd come up with a better term than essential workers, because essential workers is sort of a blah term. What does it mean to be an essential worker? Essential workers were those people who had to show up to work to keep society functioning. Essential workers were those people who had to show up so everybody else could stay home and be safe. Governor puts the state on lockdown. Everybody has to stay home. Not everybody. The essential workers have to show up. What does that mean? Because staying home only works if the lights come on and if there's heat and if when you go to the store there's food on the shelves and if when you go to the store there are supplies so that you can stay at home. Staying at home only works if, God forbid, you get sick. You call 911, somebody answers the phone, and an ambulance comes, and it takes you to a hospital. And in the hospital, there's a doctor, and there's a nurse, and there's a staff worker. So staying home isn't that easy. For society to stay home, a lot of people have to show up and break their rear end. For you to stay home safe, a lot of people have to put their lives in danger and drive the bus and drive the train and be exposed to hundreds